Alpha blockers are classified under the anti-adrenergic type of drugs. Today, we will be learning their definition, mechanism of action, classification, systemic effects, clinical uses, dosage, adverse effects, and contraindications.
What exactly is an alpha-adrenergic blocker? By definition, it's an agent that specifically and competitively antagonizes the receptor actions of adrenaline and related drugs at alpha-adrenergic receptors. Let's break that down. Competitive antagonism simply means the drug fights for the exact same binding site as the body's natural chemical. Think of it like a fake key fitting into a lock. It blocks the lock. An alpha blocker acts as a highly effective shield. It sits perfectly inside the alpha receptor. Because this blocking drug is present, the natural agonist is locked out entirely. Adrenaline simply cannot bind. Therefore, it cannot trigger its usual physiological response. However, the beta receptor remains entirely untouched. Adrenaline can still bind to the beta receptor without any issue whatsoever. This specific action helps us classify these drugs. We use a master mnemonic here. Think, non-equal people compete. This divides the blockers into two distinct branches. The first branch is non-equilibrium. This means we are dealing with irreversible covalent binding. The drug binds permanently to the receptor and simply does not let go. The prime example here is phenoxybenzamine. It's a beta-haloalkylamine. Because its binding is irreversible, its effects are phenomenal and very long-lasting. The second branch is equilibrium. These are competitive antagonists. Their blocking effect can be overcome simply by adding more adrenaline to the system. Within this branch, we have non-selective classes. These include ergot alkaloids like ergotamine, hydrogenated ergot alkaloids, imidazolines like phentolamine, and miscellaneous agents like chlorpromazine. In contrast, there is a highly selective alpha-2 class. The only drug commonly tested here is yohimbine. You can easily remember this with a simple phrase. Just think, yo, alpha-2. We also have highly selective alpha-1 blockers. You can memorize these with a high-yield matrix. The memory phrase is, please tell doctors all treatments succeed. Let's spell that out. P is for prazosin, T is for terazosin, D is for doxazosin, A is for alphazosin, T is for tamsulosin, and S is for silodosin. Every single one of these drugs specifically targets only the alpha-1 receptor. When these specific receptors are blocked, distinct systemic effects occur throughout the body. Let's look at the cardiovascular system first. Blocking these receptors reduces peripheral resistance. Blood pools in the capacitance vessels. This lowers the venous return to the heart. That decreases cardiac output, which ultimately causes blood pressure to fall. Now, this drop in blood pressure reduces blood flow to the kidneys. The renal system compensates for this. It reabsorbs more sodium and water, expanding total blood volume. In the respiratory system, blood vessels in the nose dilate. This causes nasal stuffiness. However, there is no effect on bronchodilation. The lungs rely strictly on beta receptors, which are untouched. This cardiovascular shift triggers some very important reflexes. Let's talk about reflex tachycardia. When a patient stands up quickly, these blockers interfere with normal vascular adjustment. This causes marked postural hypotension that can lead to dizziness or fainting. Furthermore, the body experiences... Let's look at the eyes. Blockade occurs in the radial muscles of the iris. This results in miosis, which is pupillary constriction. In the gastrointestinal tract, the sympathetic system normally acts to relax the gut. Blocking this relaxation increases intestinal motility. This can lead to loose motions. In the genitourinary tract, alpha-1 blockade reduces smooth muscle tone in the bladder trigone, the sphincter, and the prostate. This safely improves urine flow, but it can also cause adverse outcomes, like inhibited ejaculation. These specific systemic effects actually dictate our clinical treatments. We map these uses with a master clinical mnemonic. Think, Phecho helps the prostate, peripheral vessels, and performance. Phecho stands for Pheochromocytoma. That's an adrenal tumor. We diagnose it with a phentolamine test. Then we manage it preoperatively with phenoxybenzamine. This prevents a dangerous hypertensive crisis during surgery. HELPS stands for hypertension. We frequently prescribe selective blockers like prazosin to treat essential hypertension. Let's continue with that mnemonic. Prostate stands for benign hypertrophy of the prostate. Drugs like tamsulosin, alfuzosin, and terazosin relax the bladder neck and prostatic smooth muscle. This provides targeted urinary relief. Peripheral stands for peripheral vascular diseases. These medications relieve symptoms in vasoconstrictive conditions, like Raynaud's phenomenon. Finally, performance refers to impotence. A localized injection of phentylamine into the corpus cavernosum can safely produce penile tumescence. When administering these drugs, dosing requires careful precision. Phenoxybenzamine is typically given orally at 20 to 60 milligrams daily. It can also be given via a slow intravenous infusion. Phentylamine is administered as a precise 5 milligram intravenous injection. The selective alpha-1 blockers like prazosin, terazosin, and doxazosine are initiated at very low oral doses. This is usually around 1 milligram. Starting low prevents sudden blood pressure drops. Drugs like alfuzosin and tamsulosin are formulated as specific, modified, or extended-release oral capsules. This allows for convenient once-daily dosing. Understanding the toxicology of these medications is absolutely vital for patient safety. Our side effect mnemonic here is patients rise, nose meets stress, gut complains frequently. Let's break that down. Patients stands for postural hypotension. This is a severe first-dose effect. It happens especially with prazosin, and it may cause fainting upon standing. Rise stands for reflex tachycardia and palpitations. This heart rate spike is very prominent when using non-selective blockers like phentylamine. Let's finish the side effects list. Nose stands for nasal blockage. This results directly from local vasodilation. MEETS stands for meiosis, which is caused by radial iris receptor blockade. Stress signifies sexual dysfunction. This presents as inhibited or retrograde ejaculation. Gut relates to GI distress, including nausea or loose motions. Complaints represent CNS effects. Think tiredness, lethargy, or mental depression. Finally, frequently stands for floppy iris syndrome. This is a catastrophic surgical risk during cataract procedures for any patient taking tamsulosin. Due to these side effects, there are some strict contraindications. Our warning mnemonic is, hungry asthmatics can't drink cold coffee. Let's explore that. Hungry stands for hypovolemia. A low blood volume heavily accentuates the dangerous hypotension caused by alpha blockers. Asthmatics stands for asthma. Now, systemic alpha blockers actually lack an effect on bronchial resistance. However, ocular beta blockers are strictly contraindicated in asthmatic patients. This distinction is vital to remember for your clinical exams. Continuing our list, CANT stands for COPD. This shares the exact same logic as the asthma precaution. Drink warns of drug interactions. For instance, alfuzosin must never be used with CYP3/4A inhibitors like erythromycin. They inhibit the drug's normal metabolism. Cold reminds us of cataract surgery. Surgeons must always be informed if a patient is on tamsulosin. This is due to that severe floppy iris syndrome risk we discussed. Finally, coffee stands for cardiac risks. Non-selective blockers can actually exacerbate conditions like angina. That is because of the intense reflex tachycardia they provoke.